Testicular cancer is one of the rare cancers that we treat. In the U.S., there are about 8,000 new cancer cases a year of all the men in America. So that's a rare cancer, but if you catch this cancer in time, and if we catch it early, the cure rate is over 95%. Testicular cancer has what we call a bimodal age distribution, meaning it peaks twice. So we see testicular cancer in men in their 20s and in their 30s, and then we don't see it for several decades, and then we see it again for men in their 60s. We do not know why that is the age trend. Testicular cancer is usually only detected by physical exam when you feel a lump or a mass on your testicle. Once we are suspicious about testicular cancer, there's imaging studies and there's lab tests, but we don't pursue those unless we have found something abnormal on exam. The risk factors that we know about would be if a man has a history of what's called undescended testicles, and that would be when he was born or through childhood, the testicle wasn't located in the scrotum where it was supposed to be. And if a man has a history of testicular cancer on one side, he's at risk of getting it on the other side. There is some genetic predispositions to testicular cancer. We see more of it in patients with Klinefelter syndrome or Down syndrome, and it can run in families. This is one of the hardest cases to treat for me personally because men in their 20s don't talk about things when they're wrong, and they don't talk about the lumps that they feel, and they don't ask questions. Sometimes they don't even have health care. And if you feel something, say something. Go get it checked out. When I teach medical students how to do testicular exams, I always say check the twins, everyone wins. Because if you find it and you give that man a stage 1 diagnosis and you treat his cancer and give him a 95% cure rate, you're saving his life. When testicular cancer spreads, the treatment becomes so much more intense and the survival rate drops dramatically. Because the rates of diagnosis of testicular cancer are so low, we do not recommend screening necessarily, but you should have an annual physical exam with your primary care doctor.